Hi, my name is Anthony Spadaro, and today I will be talking to you about the effect of placebos on upper and lower body muscular strength and endurance. The purpose of this study was to examine the placebo effect on upper and lower skeletal muscle strength and endurance. Placebo effect for improvement of strength and endurance has been shown in numerous studies. Ariel and Saville demonstrated that the bench press and squat results improved significantly during the placebo period. Figure 1 shows the experimental design from baseline to testing 1 to testing 2. It investigates the placebo effect on 15 college-age males who completed tests for strength in the form of a 1 rep max bench press and 1 rep max leg press, and also endurance with the maximum repetitions at 80% of 1 rep max for the bench press and maximum repetitions at 80% for 1 rep max for the leg press. These were done at 3 separate time intervals, with the baseline testing 1, trial 1, and testing 2, trial 2, and they were completed each 4 days apart. The placebo, which was a sugar tablet, was given to participants who were made to believe that the tablet was a powerful amino acid that would increase muscle strength and endurance by 15%. The participants are told after trial 1 that the supplement had been found to have no effect on muscle strength and endurance from another study that was completed at another university. During each session, the weight lifted in kilos was recorded for strength, and for the endurance session, repetitions were recorded. Using repeated measure ANOVA, we showed that there was a significant difference for the strength test for both 1 rep max leg press and 1 rep max bench press, and also the endurance test for the 1 rep max leg press. Further analysis was conducted, observing the changes within the group over 3 time periods using 2-sided dependent t-tests. From the t-tests ad hoc analysis, each trial was compared to baseline for strength and endurance to see where the significant differences were. So as you can see in table 2 and 3, the baseline for the leg press was 97 kilos, and there was an increase in both trial 1 and trial 2 with p-values less than the alpha value to show the level of significance. In table 4 and 5, the maximum repetitions at 80% of 1 rep max leg press improved with trial 1, and even more so with trial 2, even though participants were told that the placebo would not work after trial 1. Tables 6 and 7 show the 1 rep max bench press, which increased in both trial 1 and trial 2 in comparison to the baseline. Do placebos actually work? Well, in our study, the results conclude that placebos increase strength in the upper and lower skeletal muscles. Duncan, Lyons and Hankey found that participants who believed that they had ingested caffeine lifted significantly more weight and performed more repetitions. Zanetti, Wetter, Pegelow and Dempsey found that the placebo in endurance exercise performance showed significant increase in fixed work rate endurance test by 16%. Kevorkian, Anderson, Brixton and Madsen also showed that the positive relationship occurred with significant strength increases using placebos. And the effects of the placebo may be negated by informing participants that they may receive a tablet that is inert and may cause them to fail to demonstrate the placebo effect. In our study, strength actually increased in one case after the participants were told that the placebo does not work. Placebos could potentially be used for a variety of scenarios. One scenario is pain management, where people with chronic pain and are administering anti-inflammatories, for example, they may benefit from a placebo that may be similar to an anti-inflammatory, not in the effect, but for the mental state. In talking about mental state, it could be a psychological power of mind thing with placebos. Placebos could also be used for psychological issues such as depression. Also could potentially be used for weaning off performance-enhancing drugs. Performance-enhancing drugs such as steroids have some negative side effects, and the use of placebos for this case would definitely be safer and help the athlete perform better without using a drug. And also the placebo could assist sports performance. There could be a case where team and both team and individual athletes could potentially use a placebo before a race or before practice to make them think that it's actually increasing strength and power and endurance, where it really isn't, but that is what the power of the placebo can do. And here are my references, and thank you for listening to my presentation.